This is the HC3 Podcast, and I'm your host, Megan Phillip.
There's this African proverb in English. It says, if you want to go fast, go alone, but if you want to go farther, go together. And so partnership and collaboration are just key elements, and it's central to our efforts to really make an important dent on the disparities that we're currently seeing. Understanding that there's really not a great way that a safety net could do it alone begs our other healthcare partners to come in and figure out, get in where you fit in, whether it's sharing resources, donating resources, sharing expertise. We have to not just talk the talk, but actually walk the walk. And I know there are many partners out there that are already doing this, and I'm just inviting not just our healthcare partners, but our business community, continuing with our great philanthropic community that has been such a help to the safety nets. We all have to do this together, but together we can get it done.
We talk about truer care. That's an acronym. We love acronyms in healthcare. The T stands for trauma-informed. The R, respectful. U, unconscious bias checked. E, evidence-based. And then the last R for truer is reproductive well-being centered. And that term, reproductive well-being center, is really thinking about your patients across the lifespan. How can we systematically be high performers in providing high quality care at hospitals? How do we help you make sure that the care you provide is safe, it's standardized, and you do it routinely, no matter who walks in that door? How do we make sure every hospital staff member, from the nurse that's in the room, to the provider that's the attending, to the learner, the resident, all are on board? How can we create a culture where more people can call each other in and change how we're doing it?
There's also some pretty cool examples about hospitals working with their community colleges, with their universities, even with their high schools and middle schools to create not only curricula around getting degreed and qualified to become a healthcare clinician, but also just that interest with a 12 or 14 or 16-year-old. There's some really exciting pathways in healthcare. And I think we have an obligation to do more in terms of letting young people know what those pathways are. That's happening. We've got to think creatively about how to show what those pathways are and get people excited about it.
You got to be intentional about health equity. You got to be intentional about DEI. And I think it's the same way with artificial intelligence. I can't quantify how fast things change and how much faster artificial intelligence makes the consumption, the iteration, the dissemination of data and information. I can't even put a multiple on how fast it is. But all of that, if we do not advocate and continue to fight for diverse inputs into those things, I don't know that we'll get the outcomes we desire. Innovation requires investment. There's no other way to say it. If you really are talking about the safety net, it requires sustainability. Sustainability requires investment. And it's gonna sound redundant, but funding matters. And they say, at least in my household, put your money where your mouth is.
I think in the Chicago landscape right now, there is so much innovation and incredible work happening. And I really have appreciated through We Rise Together being connected to these other projects and seeing how others are leading. And there's more and more proof points than there was a decade ago. And that's really exciting. I think the advice that I have is set a vision, start small, and just use every person out here who's done some of this work, leverage your resources, leverage your community to see if there's a way to get to a green light, especially when it's something that comes from the community and it's the community's vision.